Good morning. I am Dr. Dustan Clark. I'm the Extension Poultry Health Veterinarian for the University of Arkansas System, Division of Agriculture, Arkansas Cooperative Extension Service. I'll be lecturing to you today about avian influenza and virulent Newcastle disease. As you'll notice on the screen, Dr. Terry Conger, who is the Public Health Specialist and Epidemiologist for USDA APHIS Veterinary Services, he also put together a lot of this information. So we're going to try to present you with some information about these two diseases that can be devastating in the poultry industry. Now, the first one, avian influenza, this was observed sometime in the late 1870s, sometime thinking is around 1878 in Italy, and at that time it was referred to as foul plague because it was a very devastating disease. If we look at the virus, the influenza virus is a member of the family Orthomyxoviridae. It's a small to medium RNA virus, and there are three main serotypes recognized. Type A, which affects multiple species, especially birds. Type B, which affects humans. Sometimes we refer to that as the seasonal flu. And type C, which affects both humans and swine. Oftentimes you may hear avian influenza referred to as bird flu. A little bit more on information on the virus itself. The genome of the virus contains 8 segments of single-stranded RNA, and these segments can code for up to 11 proteins. The proteins, one of the proteins is called hemagglutinin, and it is for the attachment to cell receptors. It contains the viral neutralizing antigens, and there are 16 antigenic types, designated H1 through H16. Neuraminidase, this contains viral neutralizing antigens, and there are 9 of these types, N1 through N9. Now these are the designations that you hear talked about when we refer to the virus as saying H5N2. That would be hemagglutinin type 5 and neuraminidase type 2. The nucleoprotein contains is the major structural protein, and then the matrix, which is also a major structural protein, and it is used in screening for the PCR. It's what the PCR detects on that one. Standard nomenclature in referring to avian influenza viruses would be, for example, you see here at the bottom of the screen, right here, if I can depict that, it would be A, chicken, Pennsylvania, 137083, and then the H5N2. And we commonly refer to these by the H5 and the N2 designation. A little bit more on avian influenza. The viruses were formerly classified as LPAI, which stands for low pathogenic avian influenza, and HPAI, or high pathogenic avian influenza. Now we have, in reference to that, 3 pathogenic groups. HPAI, which can be any strain, but is primarily H5 and H7. LPAI, the low pathogenic avian influenza, which are now only H5 and H7 subtypes. And these 2 subtypes can mutate, they can reassort, they can in essence become highly pathogenic avian influenza. Then we have avian influenza A viruses, which are low pathogenicity, and these are pretty much in a separate class. Only the first 2 groups, the group 1 and group 2, are the ones that are reportable to the Office of International Epizootics, the OIE. Now, high-path avian influenza viruses, particularly H5, these are created by mutation when they're in poultry, such as chickens and turkeys. We do not see these in waterfowl. There's transmission of these viruses from poultry to waterfowl. The original transmission would be from waterfowl into the poultry, and then when we get mutations, there's transfer back. Once the HPAI is in the waterfowl population, it can be perpetuated in that group of birds and then be transmitted to susceptible poultry. Highly pathogenic avian influenza can now be any subtype of avian influenza viruses. It's no longer restricted to just the H5 and H7 subtypes, which at one time, that's the ones we referred to primarily as the highly pathogenic avian influenza. A little bit on the epidemiology of avian influenza viruses. Waterfowl and other aquatic birds are the reservoirs for all of the influenza A viruses. Usually they are not highly pathogenic avian influenza. They're usually low pathogenic avian influenza. The waterfowl contract the HPAI from poultry after it is mutated. The virus is shed via secretions from the mouth, the nostrils, the conjunctiva, and the choana. Now the influenza viruses do not circulate, the influenza viruses do circulate within the migratory flyways that these waterfowl fly in. They can increase and decrease in multiple year cycles. The two that are the reportable ones to the Office of International Epizootics, the OIE, are the HPAI and the H5 and H7 low pathogenic avian influenzas. Now, avian influenza viruses can sporadically infect mammals such as mink, seals, whales, dogs, cats. We can also have a zoonotic episode where they infect people as well. The swine origin virus, such as H1N1, H3N2, these viruses can spread into turkeys. Now here we have a picture of the migratory flyways across the world, and as you can see, these flyways all overlap at various points. For example, here in Africa, you can see we've got overlap of a couple or two or three flyways. So there can be mixing between all of these the birds in these flyways and the viruses. Now, how does the avian influenza virus transmit? Here are some designations of the transmission routes. We can have spillover, where this is coming from waterfowl, from this pond, getting into the poultry, getting into wild birds, getting into our poultry here, getting into other animals such as skunks and rabbits and things like that. Okay, transmission of the avian influenza virus, the transmission routes, into a farm and into a flock or into another flock. We have migratory waterfowl and shorebird contact. We may have imported and or smuggled birds, and these can be routes as well. We can have exposure of birds to infected or exposed birds, or fomites, such as equipment, clothing, people, multiple methods that the virus can be spread around. And then we have mutation of the low pathogenic avian influenza into highly pathogenic avian influenza. What can happen is basically from the waterfowl we can have birds on a poultry farm that become infected with low pathogenic avian influenza. This mutates into high pathogenic avian influenza. This high pathogenic and possibly even the low pathogenic as well, or in addition to it, could be spread to other farms. Now let's talk about some of the clinical forms of avian influenza. I've already mentioned LPAI, the low pathogenic avian influenza. Typically in waterfowl, this is more of an intestinal infection, and it's pretty much localized. In poultry, it is usually a mild form of the disease, and it is typically respiratory in nature. Now, any subtype of avian influenza can be possible, any of the H's and N combinations. Highly pathogenic avian influenza is an acute systemic disease with a very high mortality. Oftentimes we'll see 95% plus, and it is typically H5 and H7 types. What are the clinical signs? Again, with low pathogenic avian influenza, it's very mildly pathogenic. There may not be any signs at all. Usually some of the things that we see are depression. Birds may have some ruffled feathers, maybe a little huddling of the birds, decreased egg production, decreased activity. When going along with that is decreased intake of food and water, and some mild respiratory signs such as a cough or a sneeze, maybe some rails and rattles, and excessive lacrimation or tearing. With a highly pathogenic avian influenza, there can also be no signs with that one, just basically the birds in essence are dead. You find them dead. But some of the very same things, such as ruffled feathers, severe depression in the birds, watery diarrhea, incoordination, inability to stand, they may be prostrate, basically excess thirst, no appetite whatsoever, and then respiratory signs, coughing, sneezing, rails and rattling and things like that. One of the most important signs that we see, a very prominent clinical sign of highly pathogenic avian influenza, is a very high mortality, approaching 100% in commercial birds. Oftentimes we use the definition and say, well, 95+% mortality. Usually this death is within 2 to 12 days after the first signs of the illness. The survivors that are present are usually in very poor condition. Well, let's talk about or look at some of the clinical lesions and some other clinical signs of highly pathogenic avian influenza. In most wild waterfowl, the disease is subclinical. There really are no signs whatsoever. In poultry, though, we can have difficult breathing, which is dyspnea, oral and nasal discharges. You can see right here we have edema of the eye. We may have cyanosis of the head, the comb, and the wattle. These will be very dark in coloration. Here's the wattle, here's the comb in this bird. We can have ataxia, like we have in this bird, inability to walk. We may have ruffled feathers, and again, high mortality. Now here's some of the lesions. If you look over here, there's swelling of the face and around the eye. We've got inflammation in the trachea, a tracheitis. We have hemorrhages in the shanks of the leg. Again, in coordination here in this bird. Inflammation of the pancreas. And here we have hemorrhages on the epicardium of the heart. Diagnosis. Detection of the antibody is done by what's referred to as the AGID test. This is agar gel immunodiffusion. And it detects antibodies to the viral nucleoprotein, which is common to all influenza A viruses. This is pretty much used as a screening assay primarily. Then we have an ELISA test, enzyme-linked immunosorbence assay. This is widely used as a screening test as well. There can be some level of false positives with this test, which have to be confirmed with either direct detection or agar gel immunodiffusion. And then HI test, hemagglutination inhibition. Not typically used as a screening test, it's used primarily to detect a hemagglutinin type specific antibody in samples that are positive either from ELISA or agar gel immunodiffusion. Direct detection. Direct detection would be by detection of the antigen. There are various antigen capture immunoassays which can directly detect the influenza A nucleoprotein. These are not as sensitive as real-time PCR, that's the RT-PCR, or virus isolation, but they are very useful as a screening tool to detect this disease. Real-time PCR and RT-PCR, these pretty much are the standard routine detection methods in many cases looking for this virus. They're used for detection of the influenza A matrix gene, and these are used as a screening test followed by looking at the RT-PCR for H5 and or H7 hemagglutinin genes. Virus isolation and identification is still the best method. We refer to that as the gold standard. And this is performed in embryos. When what's happened is samples are injected into the embryos and they're trying to isolate the virus. Treatment. How do we treat highly pathogenic avian influenza once it gets into a flock? Well, there is no treatment whatsoever. It is pretty much, well, it's always basically destruction of the birds. Most of the birds, unfortunately, do die. Now, how do we control it? We can control it by surveillance methods, such as looking at live bird markets, doing surveillance there, trying to find the disease. Same thing in hobby flocks. Industry can do screening can be done in the industry, and then other types of flocks such as wild waterfowl. Control is by depopulation. The highly pathogenic avian influenza outbreaks, those birds are depopulated, and the low pathogenic avian influenza virus outbreaks as well before they become highly pathogenic. Pretty much biosecurity protocols are how we control it, how we prevent it. And these can be used not only for highly pathogenic avian influenza and low pathogenic avian influenza, but for diseases in general. The next disease I would like to talk about is Newcastle disease. Now, we used to refer to this as endemic Newcastle, and then exotic Newcastle has other names as well. If we talk about exotic Newcastle, this was discovered, at least the current thinking is, that it was in 1926 in Java, Indonesia. It's named from Newcastle on the Tyne in England in 1927. Possibly this disease was seen earlier in 1898 in Scotland. You may find historically in looking through the data that this one too was also referred to as foul plague. Can be found in 241 avian species, basically over half of the orders of birds. Incubation period, somewhere in the neighborhood of 2 to 14 days, most commonly around 6 days. It is a highly contagious disease of birds, and it is seen worldwide. It has been controlled in some countries. Now, this too is a viral disease. It is also an RNA virus. It is in the Paramyxoviridae family. It is in the Paramyxoviridae family. It is in the Paramyxoviridae family. It's referred to as Virus as the genus. There are 9 serotypes. Pretty much, avian paramyxovirus is referred to and abbreviated as APMV, and there's 1 through 9. Newcastle is the type 1. Now, we do see different types with this. We refer to these as lentogenic, which is a mild form. These viruses that are lentogenic, commonly used for vaccines, to vaccinate for what we refer to as endemic Newcastle, the milder form of Newcastle, not the exotic Newcastle per se. There are mesogenic forms, which is kind of in the middle, intermediate form, and then we have velogenic. The velogenic are by far the most virulent forms of this viral disease. We have viscerotropic and neurotropic zoonotic. Now here we have a chart breaking these down. As you can see with the lentogenic viruses, these are very common. They can be subclinical, or at least very mild, typically giving mild respiratory signs, and we see a decrease in egg production. There can be a change in the quality of the egg, such as the shell. We may have some change in coloration of the shell, or we may have some thinning of the shell in some weak areas. And then we have weight loss. The mortality itself in lentogenic strains is typically very negligible. Mesogenic, not as common. In fact, we refer to it as uncommon. We have intermediate virulence. Occasionally there'll be some neurological signs in these birds, but as you can see, it too is a mild respiratory disease causing decreased egg production, weight loss, and decrease in quality of the egg. Mortality is usually very low. Velogenic. Velogenic is, as I mentioned, it is worldwide. Newcastle is worldwide. I'm here in the United States, and it is presently absent in the United States. But this is the most serious poultry disease in the world. And we see huge problems with this one. We can have death without clinical signs. It can be very, very similar to what I talked about with avian influenza. There can be a 95% up to 100% mortality, and this one does affect trade. These other two here, lentogenic and mesogenic, typically have no effect upon trade. Exotic Newcastle has many, many names. It's been referred to as Virulent Newcastle disease, VND, VVND, pseudo-fowl pest, pseudo-poultry plague, avian pest, and you can see from this list there are multiple names for this disease. The reservoir of the virus, it too is found in wild birds, and as well as in the parrot species. Now, sport chickens, these have various names, game fowl, gamecocks, fighting chickens, so to speak. These are the viral reservoirs. How is it transmitted? Well, direct contact with feces or respiratory secretions which contain the virus. It can be spread in the water, it can be airborne, and then again mechanical transmission by fomites such as clothing, shoes, and equipment. Very, very similar to avian influenza. In fact, exotic Newcastle disease or virulent Newcastle disease and the highly pathogenic avian influenza are pretty much indistinguishable from each other. Clinical signs. We have variable clinical signs, and those clinical signs can be respiratory, where we have gasping, coughing, sneezing, and rales, and these signs are dependent upon if it is the lentogenic or the mesogenic or the velogenic. We can have nervous signs. The nervous signs can be things like paralyzed wings, paralyzed legs, twisting of the head and neck, tremors, circling, spasms, and then varying degrees of paralysis. There can be digestive signs such as diarrhea, and then egg production effects. We can have a cessation of egg production, or at least a partial cessation of egg production. We can have abnormal shape and abnormal color to the eggs. Oftentimes, eggs that typically have that brown color will be very, very pale, almost a light tan in color. Clinical signs with virulent Newcastle. Again, drop in egg production, high mortality, typically within 24 to 48 hours. Deaths, and we start seeing these and they can continue for about 7 to 10 days. Surviving birds may have neurologic or reproductive damage. If you look here at these slides, you can see we've got some exudate here and these birds are huddling, not feeling good. Other clinical signs and lesions. Periorbital swelling on the head, around the eye basically as you see right here. Again, this is also very, very similar to avian influenza. A greenish, dark, watery diarrhea can be present. Respiratory signs can be coughing, sneezing, tracheitis. Again, as I mentioned earlier with avian influenza, very, very similar. There can be neurological signs, twisting of the head and neck. You may notice a bird that has got their head almost touching the ground. Of course, the birds are going to be very, very depressed. They're not going to have an appetite, not going to drink as much water, and we may see some circling in them. Now, the signs do vary with the species of bird affected and the virulence of the Newcastle strain. But again, this may be indistinguishable from avian influenza. Here you can see we've got some hemorrhages in the conjunctiva. In this slide here, we've got swelling around the eye itself, and here is that watery diarrhea. Other lesions. Edema of the head and neck. Edema, hemorrhage, necrosis or ulceration of lymphoid tissue. Lymphoid tissue can be in various locations. We see this throughout the intestinal tract, cecal tonsils, for example. We can see some of this in the proventriculus and the ventriculus. We may have hemorrhagic lesions, such as the tracheal mucosa, as we see in this picture here, in the proventriculus and the intestinal mucosa. Here you can see are some intestines. Here are some others. We've got right here, these are hemorrhages in the proventriculus itself. Again, here's a band at the junction between the proventriculus and the ventriculus. Here are these hemorrhages throughout the intestinal tract, and here we have the conjunctivitis. We have many times all kinds of petechial hemorrhages, very, very small hemorrhages throughout the conjunctiva. Now, one thing on this one too can be zoonotic. In people, we get this conjunctivitis. As you can see, this happens usually 2 to 3 days post-exposure. Not in everyone. Some people seem to have a tremendous reaction to this, and they will have hemorrhages in the conjunctiva of one or both eyes. Typically, it's in one eye. How do we diagnose virulent Newcastle disease? Well, serum samples can be used. Basically doing hemagglutination and hemagglutination inhibition tests. These are done in diagnostic laboratories. We can do oral tracheal swabs, put those in BHI broth, which is brain heart infusion, and have a PCR test done on the swab sample, and that's a polymerase chain reaction. And then again, the gold standard would be virus isolation. Typically, a whole bird that is sick or a fresh carcass is submitted to the laboratory for diagnostic evaluation. Treatment, basically consider it the same as avian influenza. There is no treatment. So, what can we do? Biosecurity is one of the best tools we have that we can use to prevent this disease and avian influenza and other diseases from entering a farm or entering a house on a farm. And I've listed here some different things. It's a good idea to have a biosecurity coordinator. You want to have the personnel trained in biosecurity. Keep the no visitors or at least restricted signs posted at the entrance to the farm on the road there. Do not allow visitors on the farm or in the poultry houses. All farm personnel should wear separate clothing on the farm than what they wear otherwise. Clothes used on the farm should stay on the farm. You want to completely change all clothing after caring for the birds. Wash your hands, disinfect before leaving the premises. Do not visit other poultry farms. Do not visit any other poultry flocks, such as the hobby flocks and things like that. Do not visit any other species of birds. Remember, Newcastle can be carried by parrot species. Keep all the houses locked. Keep them secure. And make sure while you're working in them, you keep them locked while you're inside there. Other things, for example, thoroughly clean and disinfect all equipment. before and after use. All essential visitors should wear protective outer clothing, and you want them to sign in and sanitize their hands before they go in there. Make sure you know where they've been. Monitor all vehicles coming on the farm to make sure that proper company protocols are utilized to keep those vehicles clean. Any birds that are sick or dying, contact your service personnel immediately. You may need to submit those to a diagnostic laboratory for a proper diagnosis of the problem. Many times your service personnel can come out and do things like collect samples or perform a necropsy, as we've demonstrated in one of the videos, and that can help you out on the diagnosis of disease. Properly dispose of any dead birds by whatever method is used. That can be burial or incineration or composting. Anyone that handles wild game, especially wild waterfowl, need to completely change their clothes, shower, bathe, and disinfect before entering the premises. Some other things. It's best not to borrow equipment. Just remember that. Do not borrow equipment from any other poultry farm. You do not want to bring a problem onto your farm. Properly clean and disinfect all equipment. And I've got others listed here that you can go through and read yourself, such as providing clean feed and water. We've demonstrated some of these for you in the other video. Do not visit areas where diseases are a problem. That's one of the best things you can do. You don't want to bring something home with you. Be vigilant for disease. Follow the company biosecurity protocols. Make sure that you report any biosecurity violations. And I cannot reinforce this enough. If you have a problem, get assistance. Contact your service personnel, your company veterinarian, get help. So, in summing this up, remember, for all diseases, one of the best tools you have to prevent the incursion of a disease is biosecurity. I urge you to practice it to protect your birds and your farm, and also practice it to protect the birds and farms of others, your neighbors. Thank you very much.